A health economist helps to inform decision making with regards to funding, particularly in healthcare. So a health economist's job is about providing information about the relative costs and the relative benefits, and it's important that we look at the two together. It could be different interventions, it could be different types of health service. So for example, it could be drug treatment, or it could be a community-based model of care versus an acute model of care. So we're about looking at the relative costs and benefits of different approaches to then feed that information to decision makers so that to help them decide about how best to spend resources. Well, I sort of fell into palliative care accidentally rather than by design. About 5.5 years ago now, I decided it was the right time in my life to do my PhD. So I was looking for a supervisor and a research project. And thankfully and luckily, somebody introduced me to Professor David Currell. So he's Professor of Palliative and Supportive Services at Flinders University. And when I met with David, he talked to me about the work that the Palliative Care Clinical Studies Collaborative was doing, particularly around the research that they're doing into drug interventions in palliative care population. And that appealed to me for a number of reasons. Firstly, because my background is in pharmacy. Secondly, because it was about improving access to medications for palliative care patients, particularly in the community. So I could see the direct benefit for patients and for patients' quality of life and their caregivers and families. And thirdly, at that stage, there was virtually no health economics research in palliative care globally. So it was an area that was sort of screaming out for health economics research. So for all those reasons, I very willingly came and started working with the Palliative Care Clinical Studies Collaborative, and particularly focusing around methods for weighing up those costs and benefits in palliative care. Well, as I say, I think traditionally there's been very little research done in palliative care with regards to health economics, and there are a few reasons for that. I think both palliative care and health economics themselves are relatively young disciplines. Research in palliative care generally is very challenging, and similarly for health economics research in palliative care, because of the very complex data collection that it involves. I think those are some of the barriers that have been to health economics research. And consequently, it means in other clinical areas where there has been economic evaluations undertaken looking at those benefits and costs of different models of care and interventions, it means decision makers have had relatively easy access to that information as compared with palliative care. So when it comes to allocating sort of the scarce funds that there are, decision makers haven't had, well, they've had virtually no information that's joined up the costs and benefits in the palliative care setting. And that's where I really feel health economists can have really support palliative care teams and palliative care researchers to show the benefits that there are in palliative care to the services and to those different interventions and models of care, basically to add weight to the argument to the funders of why we need those services and how those are going to improve quality of care and how they're going to improve the patient, carer and family's quality of life. CareSearch. Now, CareSearch was something I came across first when I was doing the research for my PhD, particularly because I wanted to do a literature review, and a colleague had told me about the CareSearch site. So I went onto the site and used their search filter that they have for identifying palliative care literature, which was just fabulous because that literally would have taken me months to have come up with a search filter like that to identify the information that there was out there already. So that was my starting point. And now anytime that I want to find literature about a particular aspect of palliative care, CareSearch is my first stop. So I go and see what information is available through the links that there are on CareSearch. And again, I've used the search filters for another literature review that I'm conducting. So it's sort of been a very useful one-stop for accessing other information and other research that's been conducted and has been published.